Good afternoon, everybody. Thank you for joining us, and you are all very welcome to our webinar today. We are so pleased to be hosting this special Caru event. And what makes today that little bit different is that we are speaking to some of you directly, those of you living in your nursing homes and your families and the loved ones who support you. So you are warmly welcome to this today. We would also like to welcome the wider audience. My name is Sharon O'Brien, and I am one of 9 regional leads in the Caru programme. And this event today is being run in conjunction with Palliative Care Week, which is this week. And the theme of the week is Living for Today and Planning for Tomorrow. And the theme of our event is very appropriately named Your Voice, Your Choice, Your Advanced Care Plan. And today we will highlight the power of planning through the lived experience of our speakers. We appreciate that some of what we discuss today may be sensitive, but we hope that the hour gives you food for thought, and remember that this empowers you to become a very active voice in your future care. A little bit about Caru. It's an initiative of the Irish Hospice Foundation in partnership with the All Ireland Institute of Hospice and Palliative Care and the HSE. Caru is a continuous learning programme that supports and empowers nursing home staff in palliative, end-of-life care and bereavement care. We are currently 3 years into our 5-year programme. Caru is a free programme and it is available to all public, private and voluntary nursing homes. How do we manage Caru? We have a number of approaches. We have our face-to-face workshops, we have our regional and virtual networks, and then our webinars and Project Echo are led out on by the All Ireland Institute of Hospice and Palliative Care. Supporting me today is my colleague Mark Murphy, Regional Lead in Cork and Kerry. And I do have to warn you in advance that there is a strong Cork theme today. Laura Kinsella is our administrative support. And presenting today, we will have Gavan O'Sullivan. Gavan is a clinical nurse manager in a 38-bedded purpose-built dementia unit in St. Luke's Home in Cork. Gavan joined the St. Luke's team 5 years ago, building on his background in community palliative care and his commitment to supporting people living with dementia and their families. Gavan also holds a Master's in Palliative Care from King's College in London. Dr. Eoin Monahan has completed his medical internship at University College Cork before gaining experience in Cambridge, where he worked with Dr. Nicholas Coney, a leader in geriatric medicine. This has shaped his holistic, compassionate approach to caring for older adults. And since returning to Cork in 1997, Eoin has worked as a GP on the north side of Cork City with his colleague, Dr. McNeice. So how the next hour will run, Gavan will present, followed by Eoin, and we have set them a tall order of limited time to discuss a huge topic. We apologise for that. We will then have a brief Q&A, bringing on our 2 remaining panel members who I will introduce at this time. The questions for today we collected at registration for the event. Due to a very large registration, we are unable to facilitate a live Q&A, but if you do have any questions at the end of this webinar that those caring for you cannot answer, then please reach out to us and our contact information will be on the final slide. So we're going to start the webinar with a video that gives a brief explanation and introduction into advanced care planning. Just a mention that Think Ahead is the Irish Hospice Foundation's guide to advanced care planning. Eoin will mention earlier versions of Think Ahead, which the IHF has developed over time. It keeps changing as we learn more about what really matters to people. And this really demonstrates that planning for the future is an ongoing process. I am going to stop talking now and we'll get this started. Mark, if you could play the video, please.
Thinking about illness and injury, let alone end of life, can be stressful. Most of us try to avoid thinking about it and simply carry on with our everyday lives. But not thinking about these things doesn't make them disappear. Just like talking about what might happen in the future, including the end of life, doesn't make it happen any sooner. Addressing the elephant in the room, however, can reduce stress and anxiety both for you and those close to you. With advanced care planning, you can ensure you receive the best care available when you need it most, and that your preferences and decisions are respected. The Think Ahead Planning Pack is a tool to guide these conversations with your loved ones and to record your choices. Each planning pack comes with 3 documents. In My Personal Wishes and Care Plan, you can record your preferences for care. For example, where you would like to be looked after. It includes information about your legal and financial paperwork and your funeral plans. These decisions are important to describe so others know how to look after you and don't have to make those decisions for you. In My Advanced Healthcare Directive, you can record your healthcare decisions and name a representative to make healthcare decisions on your behalf in the future, in case you are in a situation where you cannot make your decisions heard. The 3rd document is My Medical Summary Form, which summarizes all your details so you can share them with your GP or consultant for your medical file. You should make and share copies of all the documents and place the originals in a safe and accessible place. With advanced care planning, you are taking your care into your own hands. Rest assured that your voice will be heard through all stages of your life.
Now I'm going to hand over to Gavan. And Gavin is going to start today's discussion on advanced care planning for residents living with dementia. Included in this presentation is a video of Philip discussing how an advanced care plan would have helped him navigating his mum's dementia journey. Thank you, Gavin.
Great. Thank you, Sharon. As Sharon said, my name is Gavan O'Sullivan. I'm a clinical nurse manager at St. Luke's. I'm grateful to be here today to be part of this discussion. St. Luke's has been a nursing home in Cork for the last 150 years. It's a charitable trust, and altogether we're home to 128 residents. We have 5 units and I manage 2 of those, and they're purpose-built units for our residents who are living with dementia. At St. Luke's, we try to adopt a public health approach to palliative care. And what I mean by that is that we just feel that palliative care involves everyone, where our focus is on living well as possible for as long as possible. I think about the advanced care planning really as being an opportunity to have a conversation about hoping for the best and preparing for the rest. Thanks, Mark. I might actually, before we change the slide, just mention that there are a number of different tools that are used in advanced care planning and drawing up an advanced care directive. And certainly the one you might be more familiar with is the Thinking Ahead Planning Pack. But at St. Luke's, we're probably more familiar with a tool called Let Me Decide, which was developed by a gerontologist, Professor William Malloy, who worked in Canada and then came back home to Cork. And I think decided that there was an important need to facilitate conversations between healthcare professionals, their patients, residents, and family members about their values and preferences for future treatment and care. So that's currently the model that we've adopted at St. Luke's, but I know because it pre-existed the Assisted Decision-Making Act that it may not be as compatible, for instance, as the Think Ahead Planning Pack. And I probably associate the Let Me Decide as being something that's being used more by healthcare professionals than the Thinking Ahead Planning Pack, which is probably more up to date in that regard. Thanks, Mark. So I suppose if we're seeing the advanced care planning as being a process of community between the individual, the people who are providing healthcare and their families, then really what we're talking about is starting the conversation with residents and their families. And I was quite taken really by this quote of Ira because I think there's a lot of truth in it. I have an advanced directive, not because I have a serious illness, but because I have a family. And I think it's fair to say, since we've been having a lot of these kind of conversations at St. Luke's, and my experience has really been working with residents with advanced dementia, that a lot of the residents who've actually come directly into St. Luke's maybe have not been afforded or had the opportunity to have these conversations or to have their words heard in the same way. Thank you, Mark. So I just really wanted to share, I suppose, how we've kind of gone about the process of advancing advanced care directives at St. Luke's. And I think that although it's a very structured approach, that I think what it has become, and I think what the using the tool has done has really helped to enhance the communication among the staff and the residents and the families. It's helped us to have more courageous conversations and also to change the culture of care as well, to becoming maybe more person-centered. And also it's helped us in avoiding crisis decision-making. And one of the ways that we take this process forward, and I think it's been enshrined in St. Luke's, is that we try to have regular family meetings that are multidisciplinary, that are positively framed in the sense that we sometimes we tend to have meetings because there's a problem and we need to talk about it. Whereas I think with our meetings, what we like to do actually is use that as an opportunity to start the conversation. And typically we would do that after 6 to 8 weeks of post-admission. And this is goes hand in hand with many other conversations that are individual conversations that might have been had as a resident joined St. Luke's. But within that 6 and 8 weeks, we see it as an opportunity for that person and their family really to get to grips with managing the transition into long-term care, but also giving us an opportunity as well to build a relationship. And that time seems to be a good time from the point of view of hosting a conversation with the family. And in that regard, we consider it a natural process, really. We're talking about advanced care planning or an advanced care directive really just becomes part of an ongoing conversation with residents and families. Um, and I suppose very often we say it's not a matter of if we'll talk about it, but really when we'll talk about it. And we're very much guided by residents and families in that uh, regard. In essence, really, we followed their lead. And it also reminds us as well that the family and the resident are the unit of care. And Eoin may speak to this, but some of the most meaningful conversations that I've had have come out of these family meetings uh, with residents as well. And it's really kind of helped to set the foundation for future conversations. And it's part of an ongoing communication process as well. And I do believe that as nurses, that we need to also think about taking the opportunity to start having those courageous conversations ourselves. And this tool, along with the other tools that are out there, I think have encouraged us to do that. I think we're moving into a video now, and it's a gentleman called Phil who's talking about his mother, and I think who has dementia, and I think it probably echoes or mirrors a lot of the experiences that I would have had with families that have been involved in conversations around advanced care planning, where there hasn't been that opportunity to put their own mom or dad's words into that conversation. So I'll let Mark go ahead with that.
My name is Philip. My mother is here in this nursing home, and uh, she was a nurse herself and spent a lot of time looking after people over the years. If my mother had an advanced care program, it would have made things a lot easier on us and everyone involved, I think. She has dementia, she can't really communicate her wishes or anything like that. And to have filled that in when she was still able to, and to have her own words, and just to have it all in one place, everything, even the little things, like, and especially during that difficult time when we're having to bring her into the nursing home. So we were invited into a Caru day at the nursing home. That's when we first heard about the Irish Hospice Foundation's Think Ahead planning pack. And we knew we wanted to try and fill it out as best we could for mom. So we got everyone together, like me and the aunts and my brother and everything, and we sat down and we went through it ourselves. And it was very helpful to kind of even think little things you don't even think about. If, like, it's like, just writing down what, like, kind of food she liked and things like that. And it's things we say to the nursing home, but it would be great to have it there written in it too, just in case, like, because new people come in, new staff come in, and to be able to, so anyone can just look at it and just know this is what she wanted, this is what she liked, and to give her the best care that they can. Because, I mean, we don't know how long mom's going to be here. Like, something could happen to me, and then I wouldn't be there to tell the nursing home, what she wanted, and to have it all just for us, like, that peace of mind that it's there. It takes a load off knowing that she will be advocated for by this. People don't like to think about it, obviously, but everyone's life comes to an end at some point, and you want to make sure that it's all done the way they want it. And it's something you don't think about when someone is perfectly healthy and free to talk about it. And we did thankfully talk about it a bit as things progressed, but not everyone's that lucky. It could have been a quick thing, and then you don't know. You don't know what they would have wanted. And but to sit down with the care plan and go through it with her, and I wish we had had that. And I think a lot of people think that, oh my God, it's going to be complicated and stressful and everything like that. And honestly, going through it myself, it was reassuring and thought provoking as well. Like the things you don't think about, it's not that hard, to just sit down in an afternoon and go through it. The one thing I could leave you with is that I wish that I had been able to sit down and do this with my mother 20 years ago before she got unwell, and it just would have made the whole process so much easier and been so much better.
Thank you, Mark. I think Philip very eloquently really speaks about the importance of having this conversation as early as possible. And I think from my own experience of having those kind of conversations with families, I think in terms of positive benefits, it helps reduce stress. It improves the quality of life for the resident and family, and it reduces medical interventions at the end of life. So I think that it would potentially be something that would be very positive for all concerned. I've been asked just to say a little bit about capacity, because I think one of the biggest challenges when using these kind of tools really is establishing what we mean by capacity amongst a resident. And I suppose I see that as being an ability to make a decision, something that only comes into play when a person is unable to make a decision. But within that capacity is something that's very much in the moment. A lot of the residents that I work with will be able to decide what they want for breakfast, or they'll be able to decide what they want to wear that day, but they may not necessarily be able to decide or tell you whether they would like to go back to hospital or not. And I suppose capacity in that sense is related to the decision that's needed at the time. It changes, it's not set in stone. It's a process, so that it can change, and along with the advanced care plan as well, that can change according to the resident and the family. You lack capacity to make a specific decision. Really, I suppose it's weighed under four things. One is whether you understand the information, that you can retain it, and then enough to make a voluntary choice. Use and weigh the information and then communicate your decision. And I guess, as I was referring to, that depends on the specific decision that you're having to make. So I think I will hand over to Mark again now. Thank you for listening.
Thank you so much for that presentation, Gavin. And I particularly have to say I liked the slide on I have an advanced care plan, not because I'm unwell, but because I have that. Not only is it about giving peace of mind to the person who completes the advanced care plan, peace of mind to them, peace of mind also to their family, that they know their wishes are advocated for. And I think you have really highlighted that planning ahead rather than in a crisis is what's so important. I know we don't always have that. We don't have the time. Time might not be on our side, but thank you so much. I am going to move on now to Dr. Eoin Monahan. And Eoin is going to present on advanced care planning in the nursing home. And in Eoin's presentation, we have a video of Pauline, a nursing home resident, on her experience of advanced care planning. Thanks so much, Eoin.
Good afternoon. Thank you, Sharon, and thank you, Gavin, for that comprehensive presentation. And you can see how nice it is for me to work with the quality of people that I'm working with below in St. Luke's. I think I am 35 years qualified this year and a GP for 31 years. And care of the elderly has always attracted me, but but at the same time, I'm interested in everything in medicine, and that's why I became a general practitioner. I suppose I'm interested in people, and my own kind of definition of general practice is I'm an expert in the people with their medical problems and its influence on the person and their loved ones. And I think that kind of is extrapolated out then to nursing care, you know, and the elderly person. So the first slide is about the evolution of advanced care planning. So when I started first, truthfully, I wouldn't bring up this topic unless it was brought to me. And then I kind of fumbled my way through it as best I could and as honestly as I could with the person in front of me. And I've heard the word empowerment used, and I think that is the word that needs to happen to change practice. And that's what happened in this case. So there was Gavin alluded to him, Professor William Malloy, who came home to Cork. And he said, look, we need to do better for our elderly people who were dying, as Gavin said, sometimes with multiple medical interventions. And he said, look, I think we should do better. And I'm a jobbing GP, so I'm not involved in academic work as such. I facilitate and support academic work, but every now and again you get people, visionaries, who then have an academic background, who study it and then change the practice. And that's exactly what we have seen in this instance. Is he came back and he said, look, we need to get the autonomy of the individual, you know, what let them speak for themselves, what they want to happen, as opposed to what traditionally was the case, where we had a paternalistic relationship with the patients. The doctor knows best. This is what I think you should do. And really, when you look at that time in the 80s and 90s, there was the development of computerization, the development of the internet, the knowledge dissemination, the empowerment of people through knowledge. You know, so that word again, empowerment, and so the William Malloy would say, look, we need to do better. We need to get them to advocate for themselves. And these are the tools that can facilitate that. But the other thing that he did crucially was to say, this is the evidence for you to act and empower me, to the general practice, or to empower the people looking after the people in nursing homes, is that statistically, people do much better in the home from a medical point of view than being transferred to a unit that they're unknown, and we can provide personalized care for the patient. Now, they actually do better outcomes medically. You know, they can actually do better in the long term with us. But in taking that step, you need to have the word acceptance, the acceptance that the dying process may be part of the outcome of this illness. And I think that's, but if that acceptance is there, the empowerment it gives us as GPs to do our best for the patient is backed up by secondary care physicians and by evidence-based medicine, and that really, that's what William Lloyd did for us. He empowered us to say, listen, you do better than what we do in this situation. And if somebody's going to go on to die in that situation, then they will be much more comfortable in that surroundings that you can do it in. I hope that makes sense. So that's what he did. So the other thing he did is, so I said, well, how are we going to do it? And he said, well, look, I'm going to go in and I'm going to educate the nursing staff. So he educated me, but he educated the nursing staff, and he educated the nursing staff to implement the program, to have the conversations with the families, and for us to support that. Now, as Gavin's alluded to, what we now do and what we try to do is have it within family meetings a few weeks after it comes into people come into the home. And in other situations, the nurses will do it themselves, but in the dementia unit, that's what we do with Gavin. And it is very important why advanced care planning matters is important because it's trying to get it right for the individual person. It's trying to provide the best care for the individual person. It guides us in what needs to happen. So, for example, it depends on the philosophy of the person, it depends on the stage of life of the person, it depends on the stage of illness of the person, but it comes down to what the person really wants to happen. And then if it's unrealistic, or if we feel, look, clinically I'm not certain about this, then obviously we'll have that conversation, but the conversation will take place. And the conversation will take place a bit like Gavin saying, it's for the family. It's really important to try and get it right for the family. So there's multiple things involved here, but getting it right for the family. For example, if somebody's eventually will die, we'll get it right for their grieving process afterwards. We can really get that right, if it's done, and the advanced care planning gives us the structures and how to get that right, It is all about communication, and the more we do it, it doesn't take that long to cut to the chase. It doesn't take that long in the family meetings to cut to the chase about what's important for the person. And then it's a continuing dialogue between the staff or ourselves over time. It's not just one moment in time that sets the agenda. It sets it on a kind of, okay, this is what we're talking about footing, but it's a continuous conversation after that if it needs to be. Yeah. Next slide, Mark. How advanced care planning supports me as a GP. I've alluded to it already. It's trying to get the best quality of care for the person in front of me. It's to also for the families involved. It also helps me in terms of it's not so much worrying about something, but it's that when you're taking the history from the person with their life story, when you're getting the inputs from the different family members, sometimes unless you have a sort of an open discussion with the family initially, there may be family members away, there may be family members that don't agree with other family members, and you get that very quickly in terms of the dynamic within the family, but it's an opportunity then to get that right. So the conversation that we have when people come in, which includes advanced care planning, it's part of the spectrum of care that can be offered. I think that's the thing, as opposed to we're having a meeting specifically about the single entity. That's just part of the care package that we can provide, I specifically like when we talk about life story, I really love getting to the nub of the person the person that's there, in front of us. So we take it right back to, where were you born? Where were you educated? How many were you? And I suppose, truthfully, as a Cork person, it's a small society, and I'm privileged to have seen 5 generations of one family in my practice. And so I'm on the hunt. I'm on the hunt for connectivity, and connectivity sometimes will lead to knowing somebody, or know, which facilitates sometimes trust. Yeah, I know exactly what you mean. You have a sort of an inside track straight away between ourselves as regards trust. If you know this person and you respect that person and I respect that person, I think we're going to get on. And it's not, sometimes people would be critical of me. It's not that if you make contact that they're special people, but it's just that it's a human nature thing of trying to connect. But and it facilitates our continuous journey with them through their care in St. Luke's then, and advanced care planning is part of that. Yeah. Next slide. Overcoming fears and barriers. For me, and for Gavin, and I was saying before we came on air, it's so commonplace now. I'm saying, why are we talking about it? Because it's so commonplace. It's just part of our conversation. It doesn't. It's nothing unusual or hard for us. We apply it to the individual situation, and the individual dynamics and relationships can be difficult and can be challenging to deal with, but the actual topic is not. And it's not because we're empowered. We're empowered to have this conversation because of the knowledge base Willie Malloy gave us, and the knowledge base to do your best, because your best is the best that can be done for this resident. And overcoming fears and barriers. So when we have the confidence to have that conversation, I think it helps to overcome the fears and barriers for somebody who's coming at it for the first time, when there's significant ethical issues brought up for them. The other issue is over the course of my personal development as well as professional development is this loss of fear of death. Loss of fear of death. Let's get it out there. Death is part of our human experience. And as a GP, the pattern recognition about, children being born to this world, and if we can prepare properly for that and get it right for the individual, it's exactly the same at the other end of life. If we can get it right for the individual, we're not always able to. We're not always able to. Some people die suddenly, so things happen. But if we can plan it, it really is a beautiful part of our living process and our dying process. And and because it's commonplace to us, if you're coming at something for the first time, if you're coming at something where your relationship with your loved one is so intense and so important, the concept of letting go of this loved one hasn't really been discussed, because you've been so detailed with taking up with the practicalities of caring. Sometimes you lose the overview, and I think that's what we can give to families. But anyway, yeah. I think we're going to hear a lovely person, Pauline, now give her story and how appreciative she was of having the tools of the advanced care planning given to her, and that it made her feel better.
Of course, it hit me suddenly. I was going fine, living at home on my own, doing everything, doing the housework, doing the garden, doing everything, and I suddenly, in a fortnight, lost my mobility. One of the things I was hoping to do before I got sick was to arrange my funeral, because I've just 3 daughters, and for the 3 of them to be left on their own and not know what I wanted, and one would say, Mammy wouldn't like that, and somebody would say, no, Mammy would, and there could be, and I think it's important to leave it for the family to exactly what you want. Particularly my eldest daughter always kind of worried, Ma'am, if anything happened and you lost your speech, you know, we need to know what your yeah. She was very she was very anxious about that. I think it was myself and my eldest girl that did it. We went through that form, and she said she filled it in and said, "Ma'am, do you want this?" and "Ma'am, do you want that?" And I said yes or no, you know. And it is great for the staff. Then they know, as you say, they know what your wishes are. I mean, they know I don't want to go into hospital. They know I don't want to be resuscitated. They know anything like that, you know. The staff know exactly what I'm like and what I like to do and the activities I go to. So I've know, and everyone, the staff, they're absolutely fantastic. You know, they know exactly how to put up with me. But no, I never thought of a care plan. I suppose maybe I always thought I'd die at home suddenly and that'd be it. It's lovely if the family know. Like, I mean, if you had to talk to said to the family, you know, before maybe you got dementia, you had a stroke and you couldn't speak, if you said, well, if anything happens to me, I don't want this, that or the other, that at least to have an idea of what your wishes were. Families find it very hard to talk to you about dying because they don't want you to die. It's very hard to get around people until something happens to you, and then they're facing it and they have to then talk about it. But it'd make it easier if it was spoken about and you could talk about it early on. Talking personally now, it would take the fear away from me, you know, to know that everyone knows my wishes and I'm confident that they'll carry out my wishes, and I know that where I am, I'm going to get the best of care. I don't worry about anything now. Well, I'd encourage you to do it, and I'd say to you, there's nothing frightening about it. I mean, you plan to go on your holidays, but it doesn't mean if you make the plan that you're going to die immediately or anything. There's nothing to be frightened about, really. It's just that if you could possibly do it, it saves an awful lot of trouble at the end, you know.
Thanks, Mark. How to encourage staff to feel confident and empowered in supporting advanced care planning? I think I've answered that. I'm a facilitator. I'm not a leader of it. You see Gavin there leading, and through the education of how to implement advanced care planning in the home. You know, I certainly, but I'm part of the team. I'm part of the team. The interesting, we had a conversation in the work up to this presentation about how beginning the conversation in general practice. And even though I have such experience within the nursing home now doing it, I'm still not leading it in the clinic, you know, because we haven't been sort of educated. There's been so much to do for somebody at one sitting. We don't even think about it sometimes. But I can see that evolving. And when we talked about the evolving of the advanced care planning, it to me, it's a sign of a more sophisticated society. You know, we're elevating the standards of care that we're providing for people all the time. And this is part of that. You know, yeah. Next slide. Takeaway message. Yeah, so the takeaway message that I would have is that it should be very straightforward. If you're coming to this for the first time, it should be very straightforward. People make wills, they make enduring power of attorney. It should be part of that conversation almost about advanced care planning, you know? And it doesn't, it's very straightforward. It's not legalistic. It's straightforward common sense, you know? One of the things that's very difficult for advanced care planning sometimes if people are being very prescriptive in what they want to happen, very prescriptive, and things can change for that person, circumstances can change. So sometimes rather than detail, having a kind of, look, this is what this is in general what I'd like. But if you give a very prescriptive advanced care planning directive to a loved one, they're very literal people, they feel duty bound that that's what needs to happen to mom, which may not be at all appropriate at this particular time. It's very difficult to give specific examples now, but from us in the home, sometimes that would be something to just watch out for. But in our tool planning, or the tools given to us to plan advanced care planning, we it's generally the broad gist of what needs to happen as opposed to very specific details, you know. I think that's just important. And I would like to end with, I think I can get in this story just very briefly about a lovely lady that I came down to in the nursing home, and she'd broken her hip, and clinically it was obvious she'd broken the hip and she had dementia. And I said to her, listen, I'm sorry, but I think you have a broken hip and we're going to have to send you to hospital. And we hadn't the advanced care directive done at that time. She hadn't loved ones to look after her. It was just in the nursing home, but and she had dementia. But she said, "I'm not going," she said to me. And I said, "Look, I'm really sorry, but I think you should go because and she said, "Well, what will they do for me there?" And I said, "They'll fix it." And she turned her head to the window and she said, "Jim will fix it." And then she gave me this beautiful gift, which was, "Oh, let me grow lovely growing old. So many fine things do. Silks and satins and lace may not be new. There's magic in old trees, old towns a glamour hold. Why not I, as well as those, grow lovely, growing old?" Thank you.
Well, Owen, I think we need a moment after that. I could listen to you all day.
I hope I made sense.
Absolutely. No, I think it was beautiful. And I think to end on such a beautiful quote, that's fantastic. Just to comment, something that struck me when you were talking about the evolution of advanced care planning. You know, there's a quote from a band, a song called "Closing Time," and it's every new beginning is another new beginning's end. And I think it kind of ties in very nicely to what you're saying about like, we're lucky, we're learning from the generation before us that may not have been lucky enough to know the power of your voice in an advanced care plan. And, you know, also I love the way you address back to Gavin, and in a few minutes we'll meet with Orla as well, about the fact that it's a teamwork and a team approach, and we all do this together. And I think that's a wonderful perspective. I'm going to move us along to the Q&A session because I am just conscious of time. And joining Owen and Gavin on the Q&A session are our panel with Valerie Smith, who is our public engagement representative, who also lives in Cork, and Orla Coleman, Director of Nursing at St. Luke's Home in Cork. So Orla is the Director of Nursing with over 25 years of experience. So very experienced to speak on this topic. And Valerie is our Public Engagement Lead at the Irish Hospice Foundation. And Valerie manages the Think Ahead programme nationally. So she has a big remit. Orla, I'm going to start with you if it's okay. And my question, now I know it has been covered, you know, overall, but as the voice of the nurse here, who is best placed to have conversations with regard to my advanced care planning?
Hello all. Yeah, I suppose who is best placed really is whoever the resident feels comfortable really having that conversation with. It can be a loved one, it can be a family member, especially I suppose if it's like, I suppose what your wishes and wants are. I actually heard a lovely conversation a couple of weeks ago. One of our fabulous team members talking to one of her residents about what songs that she'd like at her celebration of life slash funeral, which was quite
Yeah.
lovely. And it was in a really nice conversation, and they zipped in and out, and then it was into about food or a restaurant that the lady was going to that night. It was lovely. So really it can be, as Owen and Cavan spoke about earlier, it's a team approach. Whoever the resident feels really comfortable with having that conversation. And I suppose if it's something regarding their health, the GP, nurse-led, specialist, etc. And of course, there's also, I suppose, there's really good supports like the Think Ahead package that we mentioned, the decision support services if the capacity might be an issue, and also for, I suppose, there could be, I suppose, issues regarding property or financial issues that you might need to bring expertise in.
Perfect. Thanks a million. Owen, I'm going to move on to you, but I think you probably have covered this, but we kind of tried to bring the questions together under an umbrella theme. Is it possible to change my mind regarding my advanced care plan?
Absolutely. Yeah. So that's it in a nutshell. It's an evolving issue once you get involved in it, But
Yeah.
but that said, it's not usual to change in my experience. I'm not sure, Gavin, would you agree with that? But once you get it, try to get it right at the beginning. But if circumstances change, absolutely. 100%, absolutely. Yeah. It's your document. You know what I mean? And it's there to guide us in the care that you want to happen.
Yeah.
Yeah.
That's brilliant. I think it's just important for people to know that when we're talking about planning, it's you make one, it doesn't mean it's set in stone. You can make changes. Valerie, we've given you probably the most unfair question because you could probably talk on this for an entire webinar itself. So I'm sorry for the short time frame. But is an advanced care plan legally binding?
Once the document is signed and it's witnessed by the individual and two witnesses, and they don't have to be the GP, though they can be, they don't have to be a solicitor. Then any refusals that they've made for treatments would be legally binding, and anybody that they've named as a kind of a healthcare supporter to make those treatment decisions, if they're needed, that decision on who speaks for them is also legally binding. That's the legal person that they would turn to. If they've requested or consented to treatments, that is taken into consideration. If it's an appropriate treatment, then it would then those decisions would be followed if that's the appropriate treatment. And so the short answer is yes. The longer answer is that if a person changes their mind, they can always do this, and that these documents are only turned to, if the person isn't able to make those decisions, but in which case they are legally binding.
Perfect. Thank you, Valerie. And Gavin, last but not least, and again, this probably ties in nicely with what you were talking about, but what is your advice to someone today who has concerns regarding advanced care planning and perhaps an early diagnosis of dementia?
I think I'm still really struck by Philip's words about wanting to have his mom's words heard. And I think from my own personal and private experience, it just highlights the importance of having that conversation earlier. And I think that it's more open a conversation now, and the means to go about that the support is there now. And I suppose tools like the Think Ahead that have been adopted by the Irish Hospice Foundation. I think Safeguarding Ireland have put something together as well. I think as Philip was saying, really, it's just take that step and ask a question.
Perfect. I think it's important to point out, like Pauline's sentence at the end of it, kind of, there's nothing to be afraid of,
Right.
and you get great peace of mind. And maybe from this point of view, we're looking at start these conversations early and continue them, you know. So, thank you so much to all of you. Thank you to our speakers, Owen and Gavin. You were amazing. To all the people who have been involved in the production of this event. A special word of thanks to Philip and Pauline in our videos today, to the 2 nursing homes that supported them and support Caru. Thank you all so much, the registrants and participants that have joined us. I hope that the webinar has answered some of your questions and encourage you to consider advanced care planning in a positive way, or perhaps it's just starting that thought process for you. And I think it's important to consider that advanced care planning is about planning for your future and making sure that your choices, your voice and your choices are known to those who matter to you. If you have any questions, as I mentioned earlier, that haven't been addressed today, please reach out to the staff who are caring for you or your loved one. But you are welcome to contact us directly, and Mark will have some information on the slides today.